What would you think if I told you there was a pill that you could take that would make you smarter?
Hi, I'm Dr. Bill Fricks,
And I'm Dr. Sean Miles.
and we are two board-certified physicians in family medicine with over 40 years of practice experience.
Today, we're going to tell you some medicines that might give you some brain power, but also go over some safe, natural alternatives.
Don't worry, we're not here to push pills. We mainly want to show you what's been shown to be effective and what's safe.
There have been years of studies looking at boosting brain power, and it all comes down to just a few medicines.
We often use stimulants such as Adderall, Concerta, Ritalin for helping people with attention deficits. And there's also other medications for people that have problems with staying awake. And so if they work for people that have those problems, it stands to reason that maybe they might help normal people too and give them an extra boost.
Yeah. So what the studies mainly looked at are different cognitive abilities and memory and putting things together and executive decisions and that kind of thing. And they wanted to see if these medicines could actually improve upon those, thus making you smarter. Overall, there seems to be some benefit with some of these medicines. For example, methylphenidate, or Ritalin, as a lot of people know it, seemed to be one of the ones that showed the most promise, as well as modafinil, which is the generic for Provigil, as you know. One of the studies that I looked at chess players, because they said, chess players have to be smart. People that use these medicines could benefit from it.
If you're playing at a highly competitive level, that might be helpful.
Yes.
Also might be cheating, but might be helpful.
And that's part of what it comes down to. Are these things even ethical to use? We have bans against performance-enhancing drugs for sports. What about things like chess? I'm sure there's money involved. I think these master chess champions or wizards or whatever you call them, like Dr. Fricks, they tend to make probably some money off of this, and it stands to reason that maybe these should be banned too. Are you a master wizard? So these medicines work based on dopamine and norepinephrine. That seems to be the commonality in all these medicines and how they work. They're stimulants. So a lot of people look at caffeine and say, well, that's a stimulant. Is that going to make me smarter too? Any idea, any guesses what the studies have shown with this, Dr. Fricks?
I would say that caffeine probably has a little bit of a benefit.
So I think the benefit comes down to that it increased their alertness and maybe their stamina. It didn't necessarily increase their cognition or performance that much.
And looking back at that article with the Provigil and comparing the Adderall and Concerta, those medications, they had some benefits, but they were also in kind of some subcategories, not necessarily an overall super pill that affect all aspects of cognition.
One of the things about the chess study that I found fascinating was that it actually slowed them down because people were reflecting more on their thoughts and actions beforehand. So the fact that they were slowing down, if it was a timed thing, they ran out of time and didn't do very well. But if they looked at just the ones that were completed, so it actually improved them. But if you're taking a time test, it might not be the thing for you.
We probably don't want to make everybody think these are the solution to all our troubles. Can you maybe tell us some of the limitations of these medications?
We talked about that there are some benefits, but we also want to emphasize that these benefits are pretty small and that we have not done a lot of studies on the use of these medications in a normal patient population. In medicine, we weigh the risk and benefits of medications. There's always a little bit of both.
And thus the controversy. You're taking somebody who is technically normal and giving them medicines that can affect their brain in a way that could help them, but then also it could have ramifications too. What are some of the side effects that we do see with these medicines?
Mood disorders.
Even psychosis.
Agitation, tachycardia, sometimes weight loss, sometimes gastrointestinal symptoms.
And the one that worries me the most are some of the cardiovascular effects. It can cause palpitations, irregular heartbeats, hypertension, elevated blood pressure, and could potentially even lead to stroke and heart attack in some of these people. There have been overdoses of these medicines where people have died. So it's not a completely safe thing. And that's where part of the controversy comes from, is because we're taking normal people who don't, quote, need the medicine, but then we're giving them something to potentially benefit.
So are you going to prescribe these medicines for everybody to make them smarter?
So more studies need to be done on this before you start going to your doctor and asking for these prescriptions. Do not do that. I would not go and ask your local drug dealer or your best friend.
So are there some alternative things we can do without medications?
There are some more natural things that you can do to boost your cognitive abilities, and some of the things are tried and true things that we've talked about for a long time, and that includes exercise. You're a big proponent of exercise.
I like to exercise.
Yes. Good, healthy diet. I always talk about a particular diet.
The Mediterranean diet.
The Mediterranean.
The Mediterranean
I do. It's so good. If you go back and look at all the studies with diets, it always comes down to that being the healthiest one, and that includes the brain function too.
I kind of like donuts.
Donuts, yes. What's your favorite kind of donut? Like if you had your choice
The
of donuts.
glazed one with the chocolate icing on it.
Along these dietary things, I have seen several studies promoting blueberries. And, anytime we talk about memory and things like that, a lot of people are looking at older people with cognitive problems. In this situation, they even looked at children, and blueberries worked. Blueberries. One
for
cup.
lunch.
So you did, and they were huge. Somebody asked you if they were olives. Do you like olives?
Not plain ones.
But what I say about that is even if it doesn't work, they're good for you.
It's blueberry.
Berries are the superfood.
Sleep.
Adequate sleep.
Yeah, we know that there's been good studies that show sleeping has a lot to do with concentration and memory.
Those all-night binging study sessions might not be doing as good as you think.
I can speak from personal experience. It's not as effective as you might think. If you're watching this video because you are having problems with concentration, which are problems that seem out of proportion to what other people may be going through, push pause on this video and make an appointment to see your primary care doctor. There are a number of things that could cause that.
So if you had to summarize for the masses, what's the bottom line?
There are ways that you can improve your concentration. There are some medications out there which need to be further studied that may have some benefit, but there's a lot more needs to be known about those. But there's also a lot of things naturally that you can do. Potentially trying the blueberries, eating adequately, getting your exercise. But if you're having problems, you ought to probably see your doctor and get a full evaluation.
Great advice. Thank you for watching, everybody, and I hope you tune in next time to see what we have to offer you.
Don't forget to like and subscribe, and you can also leave a comment or suggestion down below.